Hi, hello, this is Dr. Ashok, sexologist from International Center of Sexology Research and Development, Hanuman Junction, KRISHNA District, Andhra Pradesh, India. Let's discuss today about erectile dysfunction. We call it in short as ED. Sexual health and function are important determinants of quality life. Disorders such as erectile dysfunction or female sexual dysfunction are increasingly important. For a man, erectile capacity is a measure of his sexual and personal adequacy. If he cannot perform, he thinks that it will reflect on his manhood and he feels depressed, confused, embarrassed, and anxious. Successful treatment of sexual dysfunction will improve sexual intimacy and satisfaction. Any sexual dysfunction management should involve the partner also. Let's see now exactly what is erectile dysfunction. Erectile dysfunction or ED is the repeated inability to achieve or maintain an erection sufficient for sexual intercourse. Erectile dysfunction can be of severe degree where it is impossible to get any form of erection. This was known by the term impotence and it is not used nowadays because it is considered as a derogatory term now. Erectile dysfunction can be primary, in which where erections have never occurred, and secondary erectile dysfunction is where erectile dysfunction occurs after experiencing erections for some time. Erectile dysfunctions can be mild and occasional or of moderate degree. There can be brief and inconsistent erections. Erectile dysfunction is treatable at any age and there has been a growing awareness of this fact. Let's see now the incidence of erectile dysfunction. Almost every person will have experienced erectile dysfunction at some time or the other. It is estimated that there are about 20 to 30 million people suffering from erectile dysfunction. About 20% at the age of 40 years and about 40% at the age of 65 years are supposed to having erectile dysfunction. One estimate says 40% 40-year-old and 70% 70-year-old will have erectile dysfunctions. Now let's check the process of erection. In the conditions of pathophysiology. The penis has two cylindrical chambers called corpora cavernosa. They contain spongy erectile tissue and are surrounded by a tough sheath called tunica albuginea. Smooth muscles line the endothelial sinusoids, arteries, veins, and spaces are present in the erectile tissue. The corpus spongiosum lies beneath the corpora cavernosa and has urethra in it. When there is sensory or mental stimulation, the impulses through local nerves and brain cause relaxation of smooth muscles of corpora, causing the flow of blood, which fills the spaces and creates pressure within and causes penis to expand, and this results in erection. The tunica presses on the veins and prevents outflow of blood for some time, and this is responsible for sustaining the erection. When the muscles in the penis contract, inflow of blood stops and outflow of blood occurs, and hence there will be reversal of erection. Hence, erections involve a complex physiological process involving nervous system, that is brain and peripheral nerves, vascular system, hormones, and local conditions of penis. Any damage to nerves, vessels, smooth muscle, fibrous tissue as a result of disease, drugs, or injury can cause erectile dysfunction. Acetylcholine released from parasympathetic nerves causes smooth muscle relaxation. Tumescence, the vascular filling of cavernosa, depends on neural and hormonal mechanisms operated by the neural axis. The nerves and endothelium of sinusoids produce and release transmitters and modulators which control the smooth muscles. The nitric oxide, that's the pathway, is of critical importance in the process of erection. Nitric oxide release from the nerve endings causes relaxation of smooth muscles of blood vessels and corporal sinusoids that result in erection. Nitric oxide is produced by oxidation of L-arginine, the amino acid. Nitric oxide acts centrally to modulate sexual behavior and locally on the penis. Nitric oxide acts centrally to modulate sexual behavior and locally on the penis. The other factors which cause contraction of penis are noradrenaline, neuropeptide, angiotensin 2, etc. Factors that cause relaxation include acetylcholine, nitric oxide, adenosine triphosphate, etc. The peripheral nerves, integrity of vascular supply, biochemical events in corpora help to achieve and maintain erection. Autonomic and somatic nerves and numerous spinal and supraspinal sites coordinate in the process of erection. Various sensory stimuli like touch, smell, and visual factors cause erections. Hypothalamus and limbic pathways have a role in sexual and reproduction function. Information processed in the brain travels to thoracolumbar and sacral autonomic centers and the spinal columns. Dorsal nerve of penis, a branch of pudendal nerve, supplies the penis. Cavernosal nerves contain both sympathetic and parasympathetic fibers. They regulate blood flow during erection and detumescence. The somatic nerves are the branches from pudendal nerves and are responsible for sensations of the penis. Thank you. Your Dr. Ashok.